Good morning and welcome back to the Leadership Spotlight. This is where we bring forward the healthcare leaders shaping systems, strategy, and patient outcomes across the country. Today's guest is someone whose work sits at the intersection of clinical leadership, payer strategy, health equity, and system transformation. Dr. Natalie Achong is a Yale-trained physician, chief medical officer, and national thought leader in value-based care and population health. She's led multidisciplinary matrix teams overseeing national ACO and joint venture portfolios, partnered with Fortune-level organizations, and guided executive leadership teams across markets to improve outcomes and reduce cost of care. Natalie, it's great to have you here.
Hello, Eric. Great to be with you.
Excellent. Natalie, you've shared before with me that you're a history lover and someone who deeply values culture, learning, and community. When you step away from the boardroom and strategy conversations, who are you outside work?
Thank you for that thoughtful question, Eric. Well, first and foremost, I am a lifelong learner and I'm very curious. I think that's what drew me initially to be the first doctor in my family. I'm a native New Yorker. I love museums, the theater, the visual arts, and just walking through cities and exploring. That's one of my greatest enjoyment in life. I also do a lot of volunteering in the space of healthcare. I feel that it's a privilege to be a physician because you can share your expertise and your knowledge with others to really impact their lives. So throughout my career, I've enjoyed doing that with my family, as well as a passion for mentoring younger physicians and healthcare professionals. I have a deep appreciation for giving voice to individuals in the healthcare system, wherever they are in the journey, who may not have the ability to speak, because so much of healthcare matters. Really, what is the privilege of being a doctor is the ability to impact people's lives.
Excellent. I love that, Natalie, especially the way integrity and community show up in everything that you do. And that really connects to the kind of leadership work that you've done. So you've had a really unique journey: physician, educator, health equity leader, and then senior level physician executive roles across Optum and CVS Health. When you stepped into those national leadership positions, what kind of work were you doing at scale?
Thank you, Eric. That is a very important question. I know that as a physician, it's very important to always be embracing the newest models and innovations. Healthcare is a business in many ways like no other. And I've always prided myself in being at that space where I apply my academic experience as well as my love of being in organized medicine and working with physician colleagues across the country to embolden my work. So I've brought that to every leadership role that I've had, and it's served me well. I feel that it's important for physician leaders of today to not only be adept in the clinical space, but also in business and operations, as well as best practices. And then now, as of today, in the space of AI and machine learning. So I've always tried to infuse those elements into the work that I've done, while I also try to really build strong relationships within those fields. I had my experience at in the Fortune 10 companies. I had the opportunity to be promoted into national roles running national teams, and I found that matrix environment, it really served me well by having that ability to work with colleagues across the country and also to import the latest data and evidence that's happening within the country. So it's been a great
Right.
experience.
Excellent. Yeah, that's one of the things that really impresses me, Natalie, is that, you really are very well rounded from a physician, but you're in tune with the new technological advances, but always keeping those individuals and the patients in mind. So let's change tact a bit and let's talk about value-based care, because that's an area where you've led at a national level. What does successful value-based care look like when it's truly working?
Well, we know that in the last 20 to 30 years, there's been more of a mandate from the payer space and from the governmental space to have care that is not necessarily just tied for fee for service. The more you do, the more you get paid. We have to look at things differently, particularly with limited resources. and the rising, almost unsustainable rising cost of healthcare. We need to do things differently. So with that came value-based care. I've had the opportunity to lead teams that have really delved into trying to figure out what works best. And different things work best depending on location and also the line of business. So I've been able to work with teams across the country to see what works best, not only in the space of that country, but also with respect to that population. So applying best practices within population health and understanding how diverse populations have diverse needs, where we have to meet them where they are to get the best clinical outcomes. That's where value-based care comes in. We know today that the majority of care in the United States is still fee-for-service, and there's some really interesting new models that are out. I had the opportunity to look at what new advanced care models would really work in the value-based space. But increasingly, managed care organizations and health systems, and also physician groups and provider groups are looking into ways of how do we do this in a way where we can incentivize or encourage providers and physicians to embrace thinking about, are we doing this in a way that makes the most sense to
Right.
decrease utilization and also be mindful of cost? So that's where
Yeah.
value-based care comes in.
Excellent. Yeah, I agree with you. The healthcare system in the US, we've got to make some changes. The cost of care is through the roof. And with some of the threats to the reduced reimbursement, I think it's going to be even more challenging. So, another theme in your background is health equity. But you approach it very differently than most people talk about it. What does health equity leadership actually mean at a system level?
Great question. Thank you for that, Eric. Health equity is an area of scholarship that has been around for actually a number of decades now. It's nothing new. But in terms of looking at it today in the 21st century, I think it comes down to how do we actually connect best with populations, certain populations who often are the drivers of sickness and utilization. How do we make those connections so that we can ultimately meet the priority of the business goals? So I've worked hard with colleagues and working as a consultant for different systems and directly to try to impress to leadership. How do we think creatively around meeting the needs of increasingly diverse groups? And diversity takes all types of different forms. But I think at the end of the day, there is an alignment between business goals and meeting the needs of patients. I'm very much about member, client, patient centered care. At the end of the day, as a physician, I'm a patient too. And
Yes.
I have family members. We all have family members, you too, Eric, where we want to meet their needs. We see them as an individual. And that's where health equity
Right.
comes into place, is that we think about that individual and what are their needs? What are their non medical needs that may be factoring in to the composite of what health and wellness means to them? We know that oftentimes we may prescribe medications as physicians, but how many of those prescriptions are even filled? And then if they are filled, are they filled a month out, a year out? Are they being taken
Right.
as they should so that we can avoid the individual having to come back into the healthcare system or even end up in an acute site, say in the emergency room? So
Right.
adherence to medication is just one area that I focused in on a national level where we look into how do we meet the needs of the individual to improve those clinical outcomes. We have to always be thinking
Right.
about, are our patients getting better and are we doing our very best by them?
Right. Yeah, I think patient compliance is definitely an issue. I mean, we can provide the best care, but if they aren't compliant, it's not going to get them healthy. Well, you really have a diverse background, but you've continued to teach and mentor at Yale. What keeps you tied to the academic setting?
I often get that question. It's like, Natalie, with
I'm
all that you
sure.
do, I think that it keeps me grounded, Eric. It really makes me feel like you have credibility as a physician leader when you still are there at the front line, seeing patients, whether that is in the emergency room or the outpatient setting or in the inpatient setting. You still have that credibility in that you're not so distant that you don't understand what they are going through. Because oftentimes, we as leaders, as physician leaders, we have to influence those that we don't necessarily have oversight or authority over, certainly.
Right.
And when you have that direct contact as an educator, and as a clinician, it makes that fusion very clear. So I've
Agreed.
really enjoyed the ability to continue the teaching that I started when I completed my training because it keeps me excited. It keeps me connected to young folks with those agile minds, younger folks with those
Yeah.
agile minds who will question, because the questions of the 20th century are different of the questions of the 21st century. Healthcare is
Right.
changing. And I believe that some of those answers to these very complex phenomenon within this healthcare system of ours in the US rest with those younger physicians and groups. It's really exciting to teach and to share my experience with the next generation of physicians and healthcare professionals.
Yale is definitely lucky to have you.
Thank
And
you.
it really boosts my confidence in these newer physicians that are out there that they're getting exposure to leaders like you. So I think that's going to really help. When you think about environments where you do your best work, what kind of culture brings out the best in you as a leader?
For me, I think that the best place to grow as an individual is a place that is constantly growing, that it's not necessarily about title, spaces where they're having impact. It's
Right.
one thing to espouse, but it's another thing to actually show those outcomes. A space where there is an evidence based mindset that we make decisions based on the latest evidence of what actually makes sense, that we're using templates and information from where data is showing that it's making improvements and really bending the curve, that we're using that real time information, systems where they listen to their employees, their teams, their talent. That's very important. Spaces that keep a focus on the individual is increasingly the differentiation. I think there are many, many healthcare systems out there. They're fusing horizontal and vertical integration are the mainstay of what is happening within the healthcare space. But at the end of the day, patients want to feel that they matter, and systems that truly, truly demonstrate that. And when you speak to their talent and their teams and they echo that back to you, that's a place that I want to be.
Excellent. Yeah. Culture is really critical, especially in today's healthcare environment. Burnout is a huge deal. So, really making sure that they feel heard and that they're a part of the process really will help. So, Natalie, you have a very diverse experience and, impressive from a physician, entrepreneur, what have you. As you look ahead, what excites you most about the kind of role or platform that you're going to step into next?
Well, as I think about the next phase of my career, what I'm looking for is a place where there's an alignment, where we are looking on ways of actually creatively using limited resources to meet the needs from a population health perspective. I think spaces that appreciate the individual and listen to teams is important. I think a space that also today is applying data, data that is complete, data that is well curated and analyzed. That's important. These new technologies that are out there, whether it be machine learning or large language models, so much is out there, but it's not necessarily about what is sexy or hot, but actually what has clinical significance. So
Right.
spaces that actually are looking at that and has the talented teams. I think one of my superpowers is the ability to understand what's happening 6, 7, 8 steps down the road, to try to redirect and to shape the business to figure out, well, that sounds good, but is that actually going to make sense from a clinical standpoint? I think that's the differentiation that we need to see in many of these health systems, having that clinical insights that bridges those two spaces. That's the distinction that you get when you work with teams that understand that and talent that appreciates that. That's going to be the game changer, because I feel that systems, and I know from my years of practice and working with colleagues across the country on policy, advocacy, innovation, entrepreneurship, consulting, whatever space or sector that I'm in, the systems that truly differentiate are the ones that don't lose sight of the fact that that is what patients need at the end of the day. It comes down to that relationship and feeling not just heard, but also listened to and understood. So putting that as a focus is where I feel that there will be a difference between this hospital on that corner and the next hospital a mile down the street. So that's where it makes a
Right.
difference.
That's what I find so impressive, Natalie, is you're not playing checkers. You're playing chess, right? You're looking down the road as to what we need to do, what technologies can we implement, et cetera. Well, good. Natalie, thank you so much for joining us. Your insights, your leadership perspective, and the depth of your experience have been really incredible to share with everybody today. It's been a real pleasure having you with us here on the Leadership Spotlight. And to everybody watching, thanks for joining us. If you enjoyed the conversation, don't forget to like the video, share it with your network, and subscribe so you don't miss future episodes. Natalie, thank you, and we'll see you next time.
Thank you, Eric. All the best to everyone. Thank you.
Thank you.